In this video, I'm going to be sharing with you my 5 go-to exercises that I use with my clients to help them eliminate low back pain. This is a video you're not going to want to miss, so stay tuned. Hey, what's up YouTube? It's Coach Remi here from Ambassador Fitness and Performance. And today we're going to be covering my 5 go-to exercises that I use to help my clients eliminate low back pain. And these are also 5 exercises that I use to help me also eliminate my own low back problems and low back pain when I was dealing with my sciatica and herniated disc. Now, these 5 exercises that I'm going to be sharing with you today are designed to strengthen and stabilize the spine, to help your spine become more resilient and it can tolerate better stress, and also to help you reduce any stiffness in the spine that you may experience and ultimately feel better. So let's jump into exercise number 1, which many of you may be familiar with, which is the cat camel. So the cat camel is designed to reduce stiffness of the low back. So think about we're greasing the joints, and if you have some stiffness from maybe from sitting for a while or for standing for a while, this exercise will act as a little gentle mobilization for the spine. Now for the cat camel, you're going to drop down into a position where your hands are under your shoulders, knees are under the hips. And then from here, you're going to take your spine through flexion and tucking the chin in, and then going through extension and extending the neck up. Now think about breathing out as you go into flexion and breathing in through your nose as you go into extension. Now the benefit comes from the gentle motion of going through flexion and extension, not going into end range like this. What you'll see people do is they'll try to stretch in that end range position, and the benefit isn't going to come from there, and that actually may aggravate symptoms for some people dealing with flexion intolerance or extension intolerance. So the key thing is just focus on the motion, just a gentle mobilization, and we perform about 6 to 8 repetitions for this exercise. And that is the cat camel exercise. Moving on to exercise number 2, the BirdDog. The BirdDog is specifically designed to challenge rotary stability of our core. So think if we're trying to prevent rotation, and it also was designed to strengthen the low back muscles, so our erectors. So when we think of the BirdDog, we're going to go into position with our hands under our shoulders, knees under the hips, chin is tucked, and we're going to extend the opposite arm and leg. And then we would try to hold this position for anywhere from about 2 to 3 seconds, all the way up to 10 seconds. And then we'd slowly come back, nice and controlled, and we would alternate sides. A couple mistakes you might see with this exercise is that people will extend upwards really high, or they may be shifted to the side when they're performing this, or they'll perform it too quickly, just like this. And at that point, you're really just moving the body. You're not really getting the benefits of stability because you're not holding that contraction. So really focus on pre-brace the core, chin is tucked, extend the arm and leg, don't shift or drop the hip, don't extend your neck, looking at the ground, come back slow and controlled. Switch sides. And then if we wanted to make this a little bit easier, if someone's struggling with that, we could go with one arm to start, where they're pushing their hand into the ground forcefully. Or we could do one leg. And then eventually as they improve, they can go to the opposite arm and leg. So that is the BirdDog exercise. Think about trying to shoot up to perform a 10-second hold each side from anywhere from 1 all the way up to 14 repetitions for sets of anywhere from 1 to 3. Moving on to exercise number 3, the side plank. So with the side plank, what we're doing is we're challenging lateral core stability. So think of the sides here. So what you may see is if someone has a posterior lateral disc herniation or back pain to one side, they may have an imbalance in their lateral core. And it's important to identify this with a proper assessment, because if one side is stronger than the other, it may cause more stress to be going to one side and hence causing back pain. So with the side plank, typically with a newer client, we're always starting from the knees. Elbow is under the shoulder here. eyes looking forward, hand here. It can either be across the shoulder, but keep that top shoulder back, or we can stack it like this. From here, knees are going to stay down, hips are going to pop up. Hold this position. You're going to feel the side of your core working. Don't let your neck bend. Hold. Try to shoot for a 10-second hold, and then come back, and then repeat. Then you would repeat for the desired repetitions. Don't let the hips drop. Hold that position. Now, if we wanted to make it a little bit more challenging, we could go with our feet split apart, top leg in front, back leg back here, lift up, when we would hold. Now, this is a little bit more difficult because we're holding up more body weight. Now, some people may have shoulder problems, so we can do the side plank straight like this, arms crossed, neck is straight. We're lifting that top leg just a little bit. You're going to feel your core work. And then ultimately, another variation, if someone has a difficulty getting to the ground, they can perform this on the wall as well. Think about performing up to a 10-second hold upwards for anywhere from 1 to 3 sets, and we perform anywhere from 1 to 14 repetitions, depending on where the individual's at with their back pain. All right, on to exercise number 4. We have the McGill Crunch. So now we're challenging the front of the core. So we're going to go right onto our back. We're going to keep one leg straight, and then we're going to have our knee bent on the opposite leg here. Our chin is going to be tucked, hands under the low back, elbows at our side here. We're going to tuck our chin in, push our tongue to the top of our mouth. Also pre-brace your core, so think of flexing your abs. And then from there, lifting the elbows up just a little bit, and then we're going to lift our chest slightly off the ground. And then holding it, come back down. So we would hold that for anywhere from about 2 to 10 seconds, about 1 to 3 sets. And we may perform anywhere from 1 to 14 repetitions. And then we would repeat it again. If we want to make it a little bit more challenging, we can incorporate a little bit of a breathing technique in here. So taking in a breath, big breath in, through the nose, lifting up, and then breathing out through the mouth. Kind of making a little small hole with your mouth, and really pushing that air out. And then we would switch legs and do the same thing. Now, if we want to make this more challenging, we can extend the arm and leg. So you can almost get into a dead bug position here. From this position, so the hand on the low back, we're just preventing our low back from flattening out and maintaining that normal curvature of the spine. From here, same position, chin's tucked, tongue to the top of the mouth, lift the arm and leg. Come back down, repeat. And you'd switch sides. That is the McGill Crunch or McGill Curl Up, and that is designed to challenge the interior portion of our core. Finally, our 5th and final exercise, and arguably the most important, I would say, in terms of helping someone alleviate low back pain, walking. When we talk about walking, what we're doing is we're getting an individual moving. And walking can be both therapeutic, but could also provoke symptoms too for individuals if they're not walking properly. When we think about walking, we want someone to focus on a good and proper arm swing. So left leg, right arm move, left arm, right leg. So we're walking with proper coordination and a good rhythm, and think of a brisk walk as we're going through that motion. What you may see and what may cause pain for people is if they take short, choppy steps, nice and slow if they're going, that actually may increase the loading on the spine, whereas walking with more of a brisk, normal pace that actually, through the momentum and the motion, may take stress off the low back. And it also gets the individual moving, especially if they've been sitting for a while or standing or laying down for a while. Just that motion will be therapeutic for the individual. Now, when we think about walking, we may incorporate a walking interval routine for somebody. So that may look like anywhere from a 2-minute walk all the way up to, say, 20, 30, 40 minutes, multiple times throughout the day, anywhere from 1 to 6 intervals, doing that daily. And it really just depends on the individual's tolerance. And then we just try to build up the more they can tolerate. But the key thing is that they're doing the walking routine pain-free, and it's not provoking symptoms, and it's helping them with their back pain. Those are the 5 exercises that are my go-to for helping my clients eliminate low back pain, at least in terms of a starting point. And those 5 exercises were critical in terms of helping me recover from my own back issues. The key thing is, though, with each of these exercises that I've shared with you today, it is specific to the individual. Some individuals' starting point may be a little bit higher than others, whereas some may be at a very low level, and they may only be able to do a couple of these exercises or maybe even one, and that may be walking. But as they improve, they can maybe incorporate an additional exercise to the point where they can do all 5. Some individual starting point, they may be able to do 3 of these exercises. Some may be able to start with all of them, and even with maybe more advanced progressions of them, based on their fitness level of where they're coming from. The key thing is, though, to consult with a healthcare professional if you're uncertain about this, specifically maybe a McGill method practitioner or clinician, as they'll be able to specifically guide you through the process of what a starting point should look like for you and to help you with your journey to eliminating low back pain. Before we wrap this video up, I just want to mention and also be sure to download my free ebook, Unlocking the Secrets of Low Back and Disc Pain, Insights Your Doctors Might Not Have Shared. This is a free downloadable guide designed to provide you with 10 action-packed tips that will get you on the right track to your journey to eliminating low back pain once and for all. I will leave a link in the description below for you to download it. It's free, and that's the last thing I want to leave you with today. Be sure to download that guide. I hope you all enjoyed this video today, and if you have any questions, concerns, comments about anything, please leave them in the chat below. And until next time, have a wonderful and successful and productive day. Take care. See you later.